Hello everyone. So today our group will do a simulated meeting under the concept Mind Forward, the regional youth mental health campaign. The setting will be the online conference with the representatives from the Ministry of Public Health Thailand Ananya, TikTok Asia Pacific James, and UNICEF Maria, made to discuss a regional campaign for youth mental health awareness. Good morning, everyone, and welcome to today's International Planning Meeting on Youth Mental Health Promotion in Southeast Asia. We are here to discuss a collaborative project called Mind Forward, which aims to raise awareness and promote emotional well-being among young people across Thailand and neighboring ASEAN countries. This initiative brings together the public sector, private companies, and international organizations to design an inclusive and sustainable mental health awareness campaign. Our discussion will include project objectives, outreach strategies, funding, and long-term cooperation. Now, I would like to invite each participant to briefly introduce themselves and their organization. Good morning. I am Ananya Chayasut from Ministry of Public Health of Thailand, where I oversee youth wellness and school-based health programs. Mental health has become a key national priority, especially after the pandemic revealed how deeply emotional distress affects young people. Our focus is to integrate mental well-being into schools and communities so support reaches every child, not just those in hospitals. We believe partnerships with digital and global organizations like TikTok and UNICEF are essential to make mental health conversations normal, positive, and youth driven. I'm excited to collaborate on a campaign that empowers our youth to take care of their minds and each other.
Good morning. I'm James Carter. This is our and partnership manager from TikTok Asia Pacific. Our company has been leading initiative on digital literacy and online safety, and we are excited to explore how our platform can contribute to mental health awareness among young users in this region.
Hello, everyone. I'm Maria Santos. I'm a regional mental health advisor with UNICEF. We work closely with government and communities to build emotional resilience in child and adolescents. I'm happy to bring UNICEF technical expertise and global experience to this project.
All right, thank you everyone. It's wonderful to have such diverse partners here. Let's move on to today's main agenda, developing a joint plan for the Mind Forward campaign. All right. Our ministry is concerned about the rising rates of anxiety and depression among students, particularly those in the rural areas. Many young people still hide their struggles due to the stigma and the misunderstanding from the adults. The campaign should therefore focus on the awareness, empathy, and early support, reaching both youth and families. I would like the Mind Forward campaign to blend online creativity with community level engagement, especially in the schools. Together, I think we can make the mental health education practical and approachable to everyone.
That's very important point. From UNICEF data, almost 1 in 7 adolescents in Southeast Asia struggle with mental health challenges, yet most never seek help. Our campaign should focus on normalizing mental health conversation and breaking stigma.
I completely agree. From the private sector perspective, TikTok's strength is engagement. We can make this serious topic feel approachable and relevant for youth through creativity. Perhaps we could launch a hashtag My Forward Challenge where young people can share simple acts of kindness, self-care tips, or messages about resilience.
That sounds great, James. But we just need to ensure that the content stays responsible and accurate. Mental health is really is sensitive, so we should prevent misinformation or harmful trends. I suggest we could create like a small review committee with the representatives from each partner and maybe youth leaders as well to vet key materials before launch. This would balance the creativity with safety and keep the campaign trustworthy.
Yes, maybe UNICEF and the ministry can jointly review the content before it uploaded to align with verified health messages.
Wow, that's workable. Like, we could create a content moderations committee, including youth representative as well. That way, we balance authenticity with safety.
That's an excellent approach. Inclusivity with guidance. Mhm. Let's move to the next item, funding.
For a campaign of this scale, we will need a budget from production, influencer partnership, and online promotion. TikTok can provide parts of this as CSR contribution, but we would appreciate co-funding from government as well as NGO partners.
So, while our ministry's campaign budget is already allocated, we can contribute significant in-kind support that includes the nationwide school access, government media airtime, and the trained health officers to assist with community workshops. We'll also coordinate local translation and help adapt UNICEF's material for schools. This ensures that the Mind Forward campaign reaches every region effectively and not just the major cities.
UNICEF might be able to contribute technical resources such as training modules or creative material, but not financial supportive. However, we can help in connecting sponsor organs or through our regional partners.
That's helpful. Perhaps we can then structure the budgets as a shared responsibility. TikTok handled the digital campaign costs, the ministry manages offline school engagement, and UNICEF oversee capacity building and evaluation.
All right, that sounds great and fair and also practical. All right.
Okay, we should consider a mix of online and offline activities. Online engagement can create visibility, but in rural communities, social media asset is limited.
Hmm. I agree. So we should use the schools as key outreach points where teachers can hold a small discussions or activities based on the UNICEF toolkits for areas with limited internet. This will make sure no one is left behind. At the same time, the online efforts from TikTok can complement these lessons and connect youth directly with the experts. With both digital and in-person touch points, the campaign will feel united and accessible.
Maybe we can complement that with TikTok live session, like short live stream where local physiologists or youth ambassador discuss coping strategies.
Right, that's an excellent idea, James. But just to add on, to avoid the overwhelming students with too much information, we could schedule it like a monthly session instead of daily or weekly. That may work best to keep the engagement meaningful without overwhelming the students.
That reasonable. Quality over quantity. We want like sustained engagement.
Okay. Also, let's make sure that the campaign includes inclusive language and reflects Asian diversity. We can produce bilingual or subtitle versions of the main video to reach wider audiences.
That's perfect, Maria. So the ministry can assist with the Thai translation and also the local adaptation for school use as well. Mhm. And how do we measure the success of this campaign?
Okay, UNICEF can help design impact assessment tools. For example, we can track awareness level before and after the campaign through online survey and school feedback.
We can provide engagement analytics, number of participants, views, and shares to show digital reach.
Right, and meanwhile, our provincial health officers can help measure impact by tracking counseling requests and feedback from the schools, combined with the TikToks analytics and the UNICEF surveys as well. So we'll get a complete view of how the campaign performs.
That's excellent. Combining quantitative and qualitative data will give us a holistic picture.
And for the timeline, I suggest we start with a 3-month pilot phase starting January 2026, covering both urban and rural provinces. After the evaluation, we can refine the model for a regional rollout.
TikTok can prepare teaser materials by December, so we can build excitement before the official launch.
UNICEF will start teacher and content creator training by mid-December, ensuring readiness before the launch.
All right, sounds wonderful so far.
I would like to propose adding a celebrity ambassador to the campaign, like maybe a famous singer or actor, who connect with youth people that could boost visibility quickly.
That's an interesting idea, James. Though I advise some caution. Celebrity can attract attention, but they might also shift focus away from the message itself. Perhaps we start small, like with real student stories instead.
That makes sense. Maybe after the campaign gain credibility, we can bring in influencer later.
Right? I agree that involving celebrities could raise visibility, but it's best to begin with the authentic youth stories that show real experiences. Once the campaign builds credibility, we can later invite the public figures who truly align with our messages and our intentions. This phrase approach keeps the spotlight on the youth voices and ensure the message remains sincere and inclusive for them. That's a good compromise. Shall we talk briefly about long-term cooperation? We would like this partnership to extend beyond one campaign cycle, since mental health education is an ongoing need. I propose we formalize it through a 1-year renewable MOU outlining shared responsibilities and capacity building goals. This will ensure long-term sustainability and foster regional collaboration under the consistent framework.
Yes, TikTok can commit to a 1 year pilot partnership renewal based on results.
Okay, UNICEF is fully supportive of formalizing collaboration. We can include a shared framework for evaluation, expansion, and local adaptation in other Asian countries.
Excellent. That ensures sustainability and shared ownership. All right. And before we conclude, let's summarize the main outcome of today's meeting. We've agreed that one, the Ministry of Public Health will oversee the coordination with schools, provide translation, and ensure message accuracy. And secondly, the TikTok Asia Pacific, James, you will lead the hashtag Mind Forward Challenge, fund the digital promotion, and supply engagement analytics. And for UNICEF Maria, you will provide the training, educational materials, and impact evaluation. And we all will launch a 3-month pilot in January 2026, roughly, followed by a reviewed and expansion phase. I really believe that this partnership will set a strong example of how public, private, and international actors can come together to promote the youth mental well-being.
This collaboration shows how cross-sector partnerships can make a real difference in youth mental health. Together, we can change how young people view and talk about mental well-being.
I completely agree. TikTok is proud to be part of this initiative and to use our platform for positive social impact.
So, on behalf of the ministry, thank you both for your partnership and commitment. I am confident that the Mind Forward campaigns will inspire youth across the region, not only in Thailand, but also other countries in ASEAN as well, to care for their mental health and support one another. All right, thank you everyone. That concludes our session. Together, we're not just starting a campaign, we're building a movement. Thank you, guys.
Thank you.
Thank you.
Thank you.